What are the flu vaccine risks for someone with anaphylaxis? Imagine you're thinking about getting a flu shot but have a history of severe allergic reactions. It's natural to wonder if the vaccine could trigger another serious response. For people with a history of anaphylaxis, especially related to the flu vaccine or its ingredients, caution is very important. Anaphylaxis is a rapid, severe allergic reaction that can be life-threatening if not treated immediately. If someone has experienced this kind of reaction after a previous flu vaccine or to any component of the vaccine is generally considered contraindicated. That means it should not be given because of the risk of triggering another dangerous allergic response. This is true for all types of flu vaccines, whether they are inactivated or live attenuated. However, it's important to note that the overall risk of having anaphylaxis from the flu vaccine is very low. Studies estimate about 1.35 cases per million doses administered. This rate is similar to other vaccines and indicates that most people, even those with allergies, can safely receive the vaccine. For individuals with egg allergy, including those with severe egg allergy, research shows that they can usually safely get the flu shot. The key is that they should be observed for about 15 to 20 minutes after vaccination to watch for any reactions, which is a standard safety measure. If someone has had anaphylaxis to egg exposure but not to the vaccine itself, alternative options may be available. For example, non-egg-based vaccines like recombinant influenza vaccines or cell culture-based vaccines might be preferred to reduce the risk. These options are designed to minimize exposure to egg proteins that can cause allergic reactions. It's also essential that flu vaccines are administered in settings equipped to handle allergic emergencies, including immediate access to epinephrine, which is used to treat severe allergic reactions. People with a history of Guillain-Barré syndrome, a rare neurological condition, should discuss their situation with a healthcare provider, especially if the syndrome occurred within 6 weeks of a previous flu vaccination. Moderate or severe illness at the time of vaccination is another consideration. Vaccination is usually postponed until recovery to avoid confusing symptoms. In practical terms, if you or someone you know has a history of anaphylaxis related to the flu vaccine or its components, a healthcare professional will carefully review the allergy history. They might recommend special precautions, alternative vaccine formulations, or even postponing vaccination. For those without a history of vaccine-related anaphylaxis but with other allergies, vaccination is generally safe and highly recommended because it helps prevent influenza and its complications. Balancing the small risk of anaphylaxis with the significant benefits of flu vaccination is key. Vaccination protects against influenza infection, which can cause serious illness, especially in vulnerable groups. Always consult with a healthcare provider to make the best decision based on your individual health history. Remember, medical professionals are there to guide you through safe vaccination options tailored to your needs.